The pancreas is for glucose regulation. Insulin and glucagon are produced by the islets of Langerhans cells in the pancreas. Insulin targets the liver, muscles, and all other cells. It is released after a meal to lower glucose levels in the blood. It does this by increasing all cells' permeability to glucose. Glucose is stored as glycogen in the liver and muscle cells, and it is antagonistic, so has an opposite effect, to glucagon. The way we're going to remember that glucagon is released is when glucose is gone or you have low blood glucose levels. It targets the liver. It's released after fasting to raise glucose levels in the blood. Glycogen is converted to glucose in the liver and released into the blood. Let's look at the negative feedback loops. If there's high blood sugar following a meal, then the pancreas from the islet cells is going to release insulin. Insulin goes to the liver, muscles, and all cells and causes the conversion of glucose into glycogen. Remember, it also makes all cells permeable to glucose. So without insulin, we can't use the glucose that we eat. Okay, once the insulin has done its work, then blood sugar level is decreased, which turns down the production of insulin. If there's low blood sugar following fasting, then the pancreas releases glucagon because the glucose is gone, goes to the liver, causes conversion of glycogen into glucose. This raises blood sugar and then turns down the production of glucagon. Diabetes mellitus is having no insulin or when the body becomes resistant to insulin. The result, high blood sugar levels after eating, called hyperglycemia. Glucose can appear in the urine, whereas normal urine contains no glucose. Glucose also draws water from the body, so this person has large volumes of urine. More symptoms of diabetes include frequent urination and constant thirst, low energy levels because this person cannot use glucose in the blood to make ATP in cells, so they are always tired. They have lots of sugar in the blood, but little moves into the cells, break down fat and proteins for energy, and sudden weight loss. This is a picture of a boy before and after insulin treatment. There's two types of diabetes mellitus. Type 1 is an autoimmune disease that destroys the islet cells in the pancreas. The treatment is insulin injections. Type 2 is due to decreased insulin production or resistance to insulin. Genetics and environmental factors such as poor diet, being overweight, and inactive are contributing factors. Treatment includes weight loss, exercise, eating well, oral drugs, and insulin. So what's the difference between type 1 and type 2? Type 1, the body cannot produce the insulin it needs. The incidence is growing steadily. It's usually diagnosed in children or young adults, but someone can get it at any age. The causes are unknown, but develops when the immune system attacks insulin-producing cells. Symptoms often appear suddenly and must take insulin daily. Type 2 diabetes is when the body produces too little insulin or is unable to respond to it. The incidence is rising at an epidemic rate. Healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco use can prevent or delay the onset of type 2 diabetes. Risk factors include advancing age, obesity, poor diet, family history of type 2 diabetes, physical inactivity, and ethnicity. Some populations are at higher risk of type 2 diabetes, such as those of South Asian, African, Hispanic, or Aboriginal descent, those who are overweight, older, or have low income. Diabetes rates are 3 to 5 times higher in First Nations. In type 2, the symptoms often appear gradually, and it's often managed by exercise and a healthy diet or oral medication. If the condition progresses, it can be treated with insulin. So a person with type 1 diabetes has to give themselves insulin injections. It's the only way they're going to control the amount of insulin in their body. They check their blood glucose 8 times a day. and give themselves injections 5 times a day. They have to eat a certain amount of food with each injection, whether they are hungry or not. More recently, insulin pumps are used. These are continuously monitoring baseline and that gives baseline insulin constantly supplied. The person has to enter the amounts of carbohydrates eaten so that more insulin can be given after a meal. Another treatment for people who are really sensitive to their fluctuating insulin levels is an islet cell transplant. The U of A hospital is the leader in islet transplants. It's called the Edmonton Protocol and was developed by Dr. Shapiro and his team. It involves isolating islet cells from a donated pancreas and transplanting them into the liver of an insulin-dependent recipient with severe type 1 diabetes. The donor islet cells produce insulin, which helps the transplant recipient regain control of their blood sugar levels, eliminating or greatly reducing the need for insulin injections. Recipients typically undergo 1 or 2 transplants months apart. It is not a cure for type 1 diabetes because patients are required to take anti-rejection medications for life. So during the procedure, they take a pancreas from a person who has passed on, they remove the islet cells from it, and then they transfer the islet cells to the portal vein in the liver of the recipient because it has a huge blood supply, so those cells will receive a lot of oxygen. Let's review the glands and hormones that they produce that affect blood glucose in the body. The pancreas produces insulin. It causes the conversion of glucose into glycogen in the liver, and it lowers blood glucose. Glucagon is released when your glucose is gone. So it causes the conversion of glycogen back into glucose in the liver, which goes into the blood to increase blood glucose. The adrenal cortex releases cortisol, which increases amino acids in the blood, which go to the liver, which converts it to glucose. This increases blood glucose. The adrenal medulla releases epinephrine, which causes the conversion of glycogen to glucose in the liver, which also increases blood glucose.